And you want to touch the whole thing. And without touching the good skin underneath. Not that anything would happen, it's just a little bit more uncomfortable. There's another tiny little skin tag. See how they turn a little grayish? Not all of them look the same when they treat. So this one looked a little different than this one, but I'm not going to go back to this one because this one looked like it was treated better. Once you've treated it, you go and move on to the next. You never ever want to retreat. So here's a cherry angioma. Gone. Okay, so we'll work her décolleté here in a very methodical fashion. And what we're trying to do is accomplish making her décolleté look more homogeneous. Some of these, we'll treat these flat hyperpigmented areas and this cluster of capillaries. So, and that's a little rough brown spot. Raised here, little raised fibroma. A little bit more witch hazel. How you doing, Coral?
Doing well, doing well.
Good. Okay. So our flat hyperpigment, you want to be very careful with because it's flat on the skin, and you want to be methodical. As large as this one looks, you don't want to treat haphazardly. You want to treat very methodically, and I'm going to treat in lines. Tap, 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 tap. Give her a little rest. Tap, tap, and that one's treated. And here's another tap, 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 tap. Right next to it is a cherry angioma. Okay, so I'm kind of treating in this mode here. I'll treat these. She likes to wear her low-cut shirts. So you can see that some of the pigment even comes up off onto the probe here. Okay, we'll do these last with a different probe, a smaller probe. Here's a larger cherry angioma, and I'm going to hold it. I might need to hold a little longer than normal. Nope. Here's the one everybody's been wanting to have treated. So I'm going to pick it up and move it to the next area that is red. I was a little short on that one. There we go. So you just have to be patient. Okay, so that all looks pretty good. I think, unless you think I missed anything. Oh, a little skin tag here. If can the camera see that? Can you see that? Okay. So I'm going to put it on this, and it's that little floppy one that you felt there, Coral. Yeah, sometimes it might get stuck on your necklace. Okay, so I'm just going to pull the skin like so, and I'm just going to tap the entire head. And what's going to happen is it'll turn white like a little cupcake, and this will fall off in a few days. If you have a very large skin tag, it may need a couple treatments. There we are. Good deal. Okay, well that concludes this side and her décolleté. I'm going to go ahead and do the other side. We'll take a picture, I'll moisturize and with a moisturizing sunblock, and then we'll let Coral go. She'll be back in the office in a week or two for some more pictures, and then in a month to get her full healing, what she looks like. Well, thanks, Coral.
Thank you.
Alrighty, I neglected to treat the capillaries on film, so I want to show you how to track this capillary. I go to the smallest end here, and I'm going to touch 3 seconds. 1, 2, 3. 1, 2, 3. 1, 2, 3. So you can see it's a pretty tedious procedure. However, it's so effective. Keep your probe close to each other, and you'll see that the capillary just disappears. And you want to make sure that your client is ultra careful with terry cloth, not to scrub the area, not to break anything open. And as you do this, sometimes you'll see that the redness sort of disappears. So I'm just going to do this last leg here. That's a little different than the nose, wasn't it, Coral?
This was much easier than the nose.
Yeah. The nose can be a little tight, so make sure that that's one of the last things you do for your client, because they may think it's a little bit more uncomfortable. But the great thing about this machine, there's no noise, no buzzing, no spark gap at the end, so it's not a high fricating type of machine. It's silent, and it does create a little discomfort, but you can see that we can get through a face, neck, and décolleté fairly quickly with client as comfortable as possible. Okay. And I just want to show you, I do have my F6 probe in, my tiny, tiny probe, but if I see something else that I wanted to clean up, I don't have to change back to my F12. Watch, I'll treat this cherry angioma with that. You treat that one that I hadn't treated. Okay, well, thanks everybody.